Good evening and welcome to the COVID-19 update. I'm Millicent Nwaka. First, here are the highlights. The National Executive Council to visit full wrath of the law on people who engage in buying and selling fake COVID-19 vaccination certificates. Ekiti State increases sensitization ahead of mass vaccination to avoid throwing expired vaccines away. And Germany records over 65,000 new infections in one day. Experts expect the numbers to double in the coming days. And 36 billion people do not have toilets that work properly, and this is why the United Nations is making it the starting point of the 2021 campaign for World Toilet Day, which is today. The observance celebrates toilets and raises awareness of the billions of people living without access to safely managed sanitation. The gravity of the coronavirus pandemic global spread heightens awareness about the important health benefits of appropriate toilet hygiene across Africa. While promising results on the vaccine front are underway, a primary effective preventive measure against the disease is basic hand washing with soap. Everyone must have sustainable sanitation alongside clean water and hand-washing facilities to help protect and maintain our health security and stop the spread of deadly infectious diseases such as COVID-19, cholera, and typhoid, among others. Well, let's take a look at the latest COVID-19 figures.
61 additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 9 states and the FCT and indicate a drop from figures reported 24 hours earlier. Gombe State had the highest number of infections with 16 cases. Taraba and Zamfara came in close second and third with 15 and 14 cases, while the FCT reported 7 cases. Kano, Lagos and Rivers states had 2 cases each, while Bauchi, Delta and Katsina states reported 1 case each. No new cases were reported from Sokoto State, and the total caseload in Nigeria has risen to 213,464. 47 more people were discharged, bringing the total number of recoveries to 206,292. There were no additional deaths from COVID-19 complications reported in the last 24 hours, keeping the total number of deaths at 2,973. Currently, there are over 4,000 people on admission, while over 3.4 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that almost 6 million Nigerians have received a first shot of a COVID-19 vaccine, while over 3.3 million persons have been fully vaccinated. Globally, more than 7.6 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 221,000 deaths recorded across countries on the continent. More than 256 million people all over the world have contracted COVID-19, while deaths are over 5.1 million.
Buyers and sellers of fake COVID-19 vaccination certificates will be made to face the full wrath of the law, according to the National Executive Council, while states are to ensure strict compliance to COVID-19 protocols ahead of the festive season. The federal government will also be ramping up the COVID-19 vaccine rollout to reach 50% of the targeted population. The governor of Nasarawa State, Abdullahi Sule, stated this while fielding questions from journalists after the 10th meeting of the council for this year, which held virtually at the State House, chaired by Vice President Professor Yemi Osinbajo.
A lot of the original cards were issued by the NCDC themselves. So right now they have their own way of verifying to know that the cards that are being displayed by people are the cards that they have actually provided or they are fake cards. You know, in that case, their own is to be able to identify and say, you have committed a crime, you know, by fraudulently coming up with some cards that are there. So the idea of punishment, you know, such people will be reported to the authorities, and the authorities will carry out such thing as pure crime, that people are criminals for doing that, and they will be treated as such. One, we are going to go around and start campaign for this mass vaccination so that we can take it, like I said, to the shops, to the markets, and all the high populated areas so that people can go ahead and be vaccinated, because it's very important for us to do that. I know in a lot of places, a lot of people are no longer taking the COVID issues as serious as we used to. But what people need to see is the increase in fatality, like I have mentioned. So we are seeing that from just 1 week to the other, fatality rate had increased from 1.4% to 14%, because of the number of deaths. So I think it's very important that people should take that seriously, and the governors will continue to make effort, to make more awareness, create more awareness among people to understand, and those people that are thinking that vaccines are not there, at least now they can go, there is enough vaccines.
And over to Ekiti State, where the government says it's strengthening sensitization ahead of the massive vaccination being planned across the state. Statistics from the state's Ministry of Health shows that many people have abandoned taking their second jabs, causing a level of waste due to vaccine expiration. Governor Kaide Fahimi had recently announced the intention of the state to vaccinate at least 2 million people by June next year. At some vaccination points visited by Channels Television, those turning up for their second jabs were told to come at a later date.
Our first dose of AstraZeneca, we had like about 125,000 people, that took the first jab. So, and it significantly dropped to like about 50% of that during for the second jab. Of course, we knew that some of those vaccines had expiry dates. Many of them expired just immediately after the second dose. So many of the doses that people didn't get did not make it to the market. I hope you understand what I'm trying to say. Okay, so that's what has happened. So subsequently, the other doses of AstraZeneca and Moderna that came, both the first dose of Moderna and the second dose of AstraZeneca was also greeted with a lot of false doses, first jabs, for people that have not even had at all. So when people that were supposed to have gotten their second dose, let's say 6 weeks later after, didn't show up, the distance between 120,000 and 50,000 people, and suddenly they show up after like about 2 months or 3 months when they were already due for their second dose to come and compete with people that are supposed to be taking the first dose of the new arrival. So those were the discrepancies that has happened. But as new vaccines are coming, we're encouraging people that they should show up for their second dose and doses, and also for people that have not even taken any of their doses at all to come and take their first jab, either Moderna and AstraZeneca, as we are now preparing for the massive COVID vaccination.
Well, joining us for more on the third wave of the pandemic is Professor Sunday Omilabu. He's a hospital virologist with the Lagos University Teaching Hospital. He joins us virtually. Thank you for joining us on the program.
It's my pleasure. Good evening.
Good evening. First, I'd like to get your thoughts. I mean, we're hearing Ekiti State complaining about wastage of vaccines. I mean, are you shocked by this? And what do you think could be the sole cause of this? Do you think that it's the fact that people are not coming? Because we understand that some people are still coming for their second jabs, but are being told that to come at a later date.
I think there will be a misinformation going on. In this type of situation, the state government need to embark on education, vaccine education, to prepare the mind of the Ekiti people towards coming out for the vaccine. I think they need to really go out and appeal to them. I would say they must have been waiting for long without the availability of the vaccines. So that might be the reasons why people are not coming up. I think they need to let them know that the vaccines are available now and they should come, and the vaccine is safe. So they need a lot of health education to really convince people that the vaccine is not to do them any harm.
And
so those are my thoughts.
Yes, Ekiti State since the beginning has been on with the education, the sensitization. So one wonders, why we're having expired vaccines when we don't even have enough for our population. But let's also look at people have spoken of their second jabs not being available at the right time, and the possibility of using a different vaccine from the one taken, to complete the dose. So implications of vaccine mixing. What's your take on this?
Yeah.
And is it safe?
Thank you. Thank you for that. Actually, it is advised that one should complete the two jabs using a particular vaccine. And of course, for the booster, then one can take any other. But from some of the tests carried out, there isn't any problem mixing the vaccine. But they do advise that we should complete the dose of whichever one we want to pick. And then, of course, if we want to now take a booster, we can now take any of the available vaccines as boosters. But there's no harm if they are given the available ones to complete the dose.
But then this is not a national policy from NAFDAC or the Presidential Steering Committee in terms of vaccine mixing. And perhaps the other question is, how long does it take for the efficacy of the first vaccine to wane such that it becomes insignificant?
For the waning, it depends on an individual. Yeah, let me repeat what I said earlier on, that for the dosage, you need to take 2 jabs of a particular vaccine. Then for the booster, you can now use any. That's what is recommended by WHO. And they've shown countries that have taken this, like Israel, and then other countries are already practicing that. And for the waning, it depends on an individual. So it's not specific. That's why we're now having conflicting reports as to individuals that receive the jab and they don't have a good level of immune response. So it's not specific. It has to do with an individual. If you want to know how long it takes for them for the antibodies to wane in there, it may take me months before it starts waning. And it will take an individual even under a month. It depends on the level of the antibodies made initially to the short reserve. Over.
So perhaps a bit more on the characteristics of what we know about COVID-19 now. But also, is it possible that some people will be asked to start their vaccination process all over again because of waiting a longer than prescribed interval between doses? Is there anything like that?
Come again. I didn't get that question very well.
So the question I asked is it possible that some people will be asked to start their vaccination process all over again? If we have, say, between 2 doses, it should be 28 days or 3 months, and it's longer than that to complete your dose, will people be asked to start all over again?
Okay, those that miss the actual period between the first dose and the second dose.
Yes, please.
It's the advice there is that it's better to stick to either the 3 weeks or the 4 weeks interval. So that the virus will the second jab will actually raise a high level of immune response expected of it. So that's what informed that. So if there is a big gap between the 2 doses, it has been shown that Pfizer, Moderna, 1 dose of Moderna produce over 60% of an immune response, which to me it's fairly okay. So, but people should not try on their own to miss the second dose as specified. So we should take it serious. So there shouldn't be any reasons for not to stick to the interval between the first dose and the second dose. And then, of course, before going into this, we really need to actually look at the antibody levels. So we have to be scientific. We have to be scientific to know what's the level of the antibodies before you now give a second jab. Over.
We'd like to thank you so much, Professor Sunday Milabu, hospital virologist with the Lagos University Teaching Hospital. Thank you so much for joining us on the program.
It's a pleasure.
Still ahead, the Yobe state government expresses concern over vaccine hesitancy. Please stay with us. Welcome back. The Executive Secretary of the Yobe State Primary Healthcare Management Board has expressed concern over the COVID-19 vaccine hesitancy by some individuals, assuring them that the vaccine is safe. Dr. Kundi Mashina, who is represented by Dr. Umar Chiroma at a sensitization exercise organized with support from the United Nations Children's Fund at the Federal Polytechnic Damaturu and College of Agriculture, Gujuba, both in Yobe State, reveals that fake news on the social media is a major setback. He charged students of the tertiary institutions not to be deceived, as many have died from the virus in developed countries that have better resources and health facilities.
When COVID-19 vaccines were first announced in Nigeria, there was a lot of unverified information on social media about them. Even now, many are still skeptical of taking the vaccine, a situation that worries the Yobe state government.
I received my first and second dose as far back as March. And I'm sure the president of the country, the vice president, and everybody, the governor of Yobe, and everybody have received the first and second dose. How many of them have ever had the sign and symptoms of disease, not to talk of dying?
Now, the government is taking the sensitization to the doorsteps of tertiary institutions in the state to enlighten both the staff and the students on the importance of taking the vaccine. Institutions visited include the Federal Polytechnic Damaturu and the College of Agriculture Gujuba, which is temporarily located in Damaturu, the state capital, as a result of the Boko Haram insurgency.
When there are sensitizations like this, it is expected that we will have a better idea of managing distances among our students, and we will also have the advantage of students realizing the actual reality of the disease.
The issue of sensitization and mobilization of community, particularly staff and students within the institution, is a welcome idea, because the information that is going on about the fake news or the fake information about the issue of COVID-19 can only be cleared when you have an information dissemination system, which is what the Primary Healthcare Development Agency is doing.
So far, the state government has visited about 5 tertiary institutions and National Youth Service Corps orientation camps, complementing the risk communication drives in rural areas.
Away from Nigeria, with more than 65,000 new coronavirus infections registered in Germany in 24 hours, a new record, health officials are warning that the numbers is likely to at least double. Germany's Bundestag lower house of parliament voted on a set of new measures to control the fourth wave, what outgoing Chancellor Angela Merkel is calling a dramatic situation. Clifford Kuhnen, Deutsche Welle correspondent, joins us now from Berlin. Hello, Clifford. Germany is well stocked with vaccinations, but how did it come to this?
Germany's vaccination quota stands at only around 68%, and it's even lower in the country's eastern and southern regions, where infection and hospitalisation rates have reached record highs. Now, some of this is down to vaccine sceptics, but others say the wide availability of free tests made people slow to get vaccinated. And you can never rule out the plain old complacency as a factor. The big difference with this fourth wave is that hospitalisations and deaths remain at a much lower level than in previous peaks, but there is growing concern about gaps in the country's vaccination coverage as it moves into the winter months. Vaccinations that were given in the early part of the summer have lost effectiveness, and boosters have become a big part of the debate. There's been a kind of a sluggish booster jab campaign, and this has picked up in recent days, and the threshold before you can get your booster has been cut to 5 months from 6 for the general population. Now, some critics have also said that because of the election campaign during the summer, many politicians took their eye off the ball and didn't see how the Delta variant would wreak havoc. They say there was just too much complacency. And then others are saying that the return to social mixing was too fast. And people here in Germany are looking to neighbours like France, which is almost 75% of its total population vaccinated. And it's weathering the new infection spike better than its neighbours.
But Clifford, what kind of new measures can we expect to control the fourth wave?
Divided into vaxxed and unvaxxed. The federal government has agreed on the introduction of restrictions for the unvaccinated in those regions where a certain hospitalisation rate is exceeded. So only those who have the vax will have free movement for leisure activities. The plans include mandatory daily testing for employees and visitors of care homes, regardless of whether they've been vaccinated or not. And they also include rules requiring people to show full proof of vaccination or recovery or a valid negative COVID test for workplaces and on public transport. And they're going to reinstate work from home rules, which is going to have a big effect. What the measures don't include, of course, are school closures, blanket travel restrictions or mandatory vaccination. Unlike, say, the United States, Germany has been reluctant to introduce the mandate. New legislation also includes the introduction of strict penalties for up to 5 years in prison for forgers of COVID documents and certificates. According to the police, the forging of vaccine passports has become a big problem in Germany, and they can be sold for up to €400. And Germany's 16 states will also be able to introduce their own protective measures. And this could see more restrictions on recreational, cultural and sporting events.
Finally, Clifford, how is the health service coping with this and what are the medical authorities saying?
Well, one thing is the pandemic has played havoc with staffing in hospitals, and this has led to fewer beds being available on intensive care wards. ICU units were already close to being overwhelmed, and people needing to be given emergency medical treatment after car accidents, heart attacks and strokes are no longer guaranteed the level of care that would normally be available. So under new measures, nurses, especially those working in ICUs, will receive a bonus, and rapid antigen tests will remain free of charge for everyone. Those who were being admitted to ICUs are far more likely to be unvaccinated and increasingly likely to have to be put on an artificial lung, which is seen as a last resort measure. They're also having to stay longer on average compared with earlier in the pandemic, owing to an increase in the severity of the disease.
Clifford Kunin, Deutsche Welle correspondent, joining us from Berlin. Many thanks and stay safe. And now Austrians are looking at the next 20 days in lockdown, starting from Monday, as the government says it is trying to curb the rise in COVID-19 cases, forcing the government to walk back promises that such blanket shutdowns were a thing of the past. Imposing a mandate would give Austria one of the world's most stringent vaccine requirements. Here's more on the Global Update.
Days after Austria imposed the lockdown on the unvaccinated, it has announced the full national COVID-19 lockdown starting on Monday. Chancellor Alexander Schallenberg said it would last a maximum of 20 days and there would be a legal requirement to get vaccinated from February 2022.
We have decided to make vaccinations compulsory across the country very quickly. This is planned to apply from February 1st, 2022, substantially increasing vaccination rates. And I think we all agree on this. It's our only way out of this vicious cycle of virus waves.
He was responding to a record case numbers and one of the lowest vaccination levels in Western Europe. Many other European countries are also imposing restrictions as cases rise. A US study published in the journal Science on Thursday says the first known COVID-19 case was a market vendor in the Chinese city of Wuhan, not an accountant who appeared to have no link to the market. The origin of the SARS-CoV-2 virus that causes COVID-19 remains a mystery and a major source of tension between China and the United States. A joint study by China and the World Health Organization this year all but ruled out the theory that COVID-19 originated in a laboratory, saying that the most likely situation was that it infected humans naturally, probably via the wildlife trade. And JS016, a neutralizing antibody against COVID-19 developed by China, administered with another neutralizing antibody, has been granted emergency use in 15 countries around the world, and its safety and effectiveness have been recognized worldwide. Currently, phase 3 clinical trials of JS016 are being promoted actively, according to the Chinese Academy of Science Institute of Microbiology.
And that's the COVID-19 update. Thank you for watching. Our website, channeltv.com, is live with story updates and a better understanding of the pandemic. It's all at your fingertips. channeltv.com. I'm Millicent Walker. Stay safe.